Good morning everyone. Today we are going to talk about strychnine poisoning. As we all know, strychnine is a spinal poison and it is obtained from the seeds of the plant called Strychnonospis vomica, also known as Nosk vomica, and it is a powerful alkaloid. And the active principles of the seeds are strychnine, brucine and loganin. Strychnine and brucine are alkaloids, whereas loganin is a glycoside. And talking about strychnine, it is bitter in taste and it is 10 to 20 times more poisonous than brucine. And it is odorless, colorless, white crystalline prism. And it is obtained from seeds only, whereas brucine and loganin are obtained from roots, stem, bark and leaves. So the whole part of this plant is toxic. And now talking about the seeds are round, disc-shaped, ash-grey in color, covered with silk fibers and is hard. And talking about the forms of seeds, it is in uncrushed form and in crushed form. The uncrushed form of the seed is not poisonous and it is not dissolved in the GIT, so passed entirely in the feces. And talking about the crushed seed, it is poisonous and it takes 1 hour to show symptoms. And if the strychnine alkaloid is taken directly, then the symptoms can be arised within 5 to 15 minutes. And now talking about the mechanism of action of strychnine, it acts as an antagonist of glycine neurotransmitter and it mainly affects the motor nerve fibers present on the anterior horn of spinal cord. As we all know, in spinal cord there is anterior horn and posterior horn, and in anterior horn there is the presence of motor nerve fibers that innervates skeletal muscles to cause movements. As we all know, there are other neurotransmitters in our body that causes the excitation of the muscles. But this neurotransmitter glycine balances the excitation of those neurotransmitters and causes inhibitions of the muscle tone. So, strychnine competitively blocks the glycine receptors at anterior horn of this spinal cord and brainstem and causes the inhibition of the glycine effects. And if there is the inhibition of this inhibitory neurotransmitter, then there will be increased excitation of the motor neurons. There will be increased excitation of the motor neurons and also stimulation of the cerebral cortex. And now talking about the sign and symptoms of the strychnine poisoning. As we have already discussed that after the ingestion of the poisonous seeds, the sign and symptoms will appear within first 1 hour. So there will be presence of bitter taste, uneasiness, restlessness and feeling of fear and suffocation in the patient. There will be difficulty in swallowing also and epigastric pain can also be seen. And these signs and symptoms are known as prodromal syndromes. And since strychnine has direct action on reflex center of spinal cord, there will be presence of convulsions. So, during convulsions, the face is cyanosed, there will be anxious look in the face, staring eyes and dilatation of the pupils can be seen. But in between those convulsions, between first and second convulsions, the muscles got relaxed and the breathing is resumed. And during the convulsions, there is also the presence of rectus sardonicus. Rectus sardonicus is nothing but the contraction of the facial muscles and jaw in which the corners of mouth has been drawn back like grinning and the mouth is covered with bloody froth. And talking about the convulsions, there is the presence of clonic and tonic movement which is more marked on the anti-gravity muscles that leads to the hyperextension of the body. And during those convulsions, we can see some movements and posture of the patient like opisthotonus, it is the backward arching of the body, and imposthotonus is the forward arching of the body, and pleurosthotonus is the lateral bending of the body. So in convulsions, the face will be cyanosed, there will be anxious look in the face, staring eyes and dilatation of the pupils, there will be rectus sardonicus, there will be opisthotonus, imposthotonus and pleurosthotonus. And in those patients, the mind is clear and the consciousness is also not lost till the death. And after 5 to 15 minutes, slightest impulse like current of the air, sudden noise, gentle touch can reoccur the convulsions. And after 4 to 5 convulsions, death can occur. and the patient cannot breathe due to the fully contracted diaphragms and the thoracic muscles, and finally that leads to hypoxia, which causes medullary paralysis and eventually death. And if the patient has survived, then also there may be some complications like hypothermia, respiratory failure, renal failure, rhabdomyolysis and myoglobinuria. And now talking about the fatal dose, 1 to 2 cross seeds are enough to kill a person, and 50 to 100 mg of strychnine is enough to kill a person, and the fatal period is about 1 to 2 hours. And for the treatment, I have made a mnemonic called CD-PASS. C stands for convulsions, D for diazepam, P for potassium permanganate, A for acidification, and S for symptomatic management. Now let's talk in detail. And now for the effective control of the convulsions, the patient should be kept in a dark room free from all the noises and disturbances so that there will be no stimulation to that patient. And initially, diazepam should be given and phenobarbital can also be given. And if both diazepam and phenobarbital are not working, then general anesthesia or muscle relaxants can also be given to that patient. Since the respiratory muscles are contracted and fixed, vapors are not absorbed properly, so the inhalation anesthesia have little value. And talking about potassium permanganate, it is used for stomach washing initially, and then activated charcoal is given to absorb the strychnine. And emesis is highly contraindicated in those patients because it precipitates convulsions. And since the strychnine is a base, acidification of urine is done to remove it from the body, and the symptomatic treatment is also done. And now talking about the postmortem changes, there are both external and internal findings, and in external findings, the signs of asphyxia can be seen, and there is no any characteristics finding in that body, and the rigor mortis sets early and passes off quickly in those bodies. And talking about the internal findings, there will be condition in the brain, spinal cord, lungs, liver, stomach mucosa, duodenum mucosa and the kidneys. And the cysts can be seen in the stomach, and putrefaction is resisted in those bodies. Brain and spinal cord of those bodies are preserved for routine viscera examination. And now talking about the medico-legal aspects, there are accidental, suicidal and homicidal cases, but accidental cases are very much common and it is mostly seen in the children by eating seeds. Accidental deaths are due to the overdose used in medicinal preparations, and suicidal cases are very much rare because it is very painful, and sometimes homicidal use can also be seen in the form of powder of seeds, and it is also used for the purpose of arrow poisoning and killing the cattle. It is also taken as aphrodisiac. It is also used as respiratory stimulant and rodenticide. Thank you.